So excited. I know many of you have attended the Governor's Conference on Aging the past 2 days, and no doubt you learned a lot that will help inform the conversations that we're having this afternoon. On behalf of the Commission, I'd like to thank the staff of the Governor's Conference, without we would not be able to meet today. So I don't know where they are, but thank you Martina James, Eldon James, and Jillian Saul for all your incredible work. Unlike the Governor's Conference on Aging, however, today focuses squarely on dementia. I know that some of you are here for professional reasons and some of you are here for personal, and I'm here for both. What unites us is the shared goal of ending this disease and the pain it causes individuals, families, and society. My mother first developed Alzheimer's in her mid-40s. I was about 18, I'm the oldest child. And she went undiagnosed for about 5 years. By her early 50s, my mom could no longer cook, drive, or remember her children's names. She passed away in a facility at the age of 57. And I learned painfully that this disease has no age boundaries. And while I am not a doctor at all, like many of the colleagues on the Commission, I have spent the last 8 years volunteering my time and advocating for those living with dementia in Virginia. Right now, 1 in 9, or 300,000 Virginians over the age of 45, report cognitive decline. And about 150,000 Virginians are expected to have Alzheimer's disease currently, and that number is expected to rise dramatically as the population continues to age. That's why the Dementia State Plan is vital to ensure services and support are available when and where they are needed. A few years ago, I had the honor of working with the Alzheimer's Disease and Related Disorders Commission to develop the 2020-2024 State Plan, which we're currently implementing. We traveled around and listened and met with many stakeholders and caregivers, but what we really quickly realized is that we needed to pull together a forum of many thought leaders as possible, not only to educate, but to get valuable input into the next state plan. Our long-term goal is to build a fully dementia-capable Virginia with the most comprehensive and inclusive plan possible. And this afternoon, we will be workshopping with each of you to do just that. But before we do, we have a really exciting program lined up. I am so excited to say that today we have a keynote with Bonnie Waddles, Executive Director with Hilarity for Charity. This organization was set up by Seth Rogen and his wife, Lauren Miller, to help families living with dementia meet their caregiving needs and to help activate the next generation of dementia advocates. Next, we're lucky to have Dr. Paul Arovich, who will talk about brain health and dementia risk reduction. We'll be closing the morning out with a panel presentation with several of the Dementia State Commission members, and we'll be walking through the Dementia State Plan. And then we will end with a call to action with Commission member Karen Gardner. Please be sure to visit our exhibitors in the front if you haven't already. We've built in extra time at lunch to do so. Today wouldn't be possible without our amazing sponsors and committee members. I want to give a special thank you to our presenting sponsor, the Virginia Department of Aging and Rehabilitative Services, the Virginia Department of Health, and the Virginia Center on Aging. Our gold sponsors, VCU's Richmond Brain Health Initiative, and a special gift in memory of Eugene C. Stagmeyer. And our silver sponsor, the Alzheimer's Association. And a big thank you to our Summit Committee for planning all of this. The committee was chaired by Margie Shaver and comprised of Melissa Andrews, Betsy Sollett, Annette Clark, Rachel Connie, Evelyn Gibson, Christy Jensen, Alyssa Lofton, Ellen Phelps, and Jerry Schaff. We're so grateful for your time and your energy. And then I'd like to personally give a huge thank you to George Worthington, Dementia Service Coordinator, with JARS and staff. You made this happen, so thank you. And without further ado, I'd like to introduce Commissioner Kathy Hayfield with the Department of Aging and Rehabilitative Services, who will officially kick us off for the day. Thank you.